We take the best decision, taking into account all the characteristics of every patient. Yes, well, the first thing that the patient has to do is to fill out the questionnaire in the website. Just I can take a look at the medical questionnaire, and that's when we know if we're going to have a patient that it can be a patient that can come here and have their studies done here, or if we do have to get study or evaluation in advance. For example, patients that have a history of heart conditions, lung conditions, renal conditions, all that type of patient, I always ask for a pre-op evaluation from their doctor, so we know that the surgery can be made and that the surgery is gonna help them to overcome that condition that they have. First, we have to know that their doctor is good having the surgery with us. The second step is to decide what surgery the patient wants. It is a complex decision to make, but we take the best decision, taking into account all the characteristics of every patient. After deciding what's the best procedure for them, we schedule their appointments with our nutritionist and with our psychologist. Our nutritionist has to give them a preoperative diet in order for the liver to shrink before coming here and get the surgery. That helps us a lot to have a safer surgery, a well-controlled surgery. It is all on a video call because it's not only the surgery, the patient has to do a lot of changes in their lifestyle. So we have to make sure that they know that in advance. But not only that, they're willing to do it, that they are willing to do that change, and they know. So they know there's going to be a change. We have to prepare them not only physically, but also mentally. After that, the patient gets their surgical date, and then we start to prepare them for the surgery. How? With the pre-op diet, with psychologists. Then when they travel here, normally they come here one day before the surgery. That's when they come here to the hospital. We take x-rays, EKGs, blood work. If anything else needs to be done, it gets done. Our internist looks at the lab work, x-rays, EKG, looks at the patient, has an interview with the patient, and then when everything is ready, the next day is their surgery. Surgery varies time. It can be like 45 minutes for a sleeve, 1.5 hours to 2 hours for a gastric bypass or a mini bypass. It depends on the patient. It depends on the condition, if it is a primary surgery or if it is a revision surgery, which takes a little bit more time because it's more work. After that, for a gastric sleeve, normally the patient stays here for 24 hours. And if the patient has no digestive symptoms like nausea, and if they're able to hold down liquids, we can discharge them for the most part the next day. For patients undergoing gastric bypass or mini gastric bypass, we offer 2 night stays here. It is a surgery that is a little bit more invasive, and we like to have the patients a little bit more time here to be monitoring them that everything goes as planned. After that, if the patient has a trip that less than 2 hours, we can discharge them the next day or the next couple of days so they can go back home. But if not, we encourage patients to stay at the hotel for 1 more night and then go back to their hometown. Okay. Basically, it is a process that lasts from 4 to 5 days.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.